it is the deadliest. Okay. Basal cell is the most frequent. Okay. Most common. It grows outward. You'll see most like in the head, neck, and the back. Squamous cell, carcinoma, keratinocyte, superficial to the basalis, which normally undergo little to no division. The squamous cells beginning to divide. Okay, the squamous cell is, so basal cell is the most common. Okay, squamous cell is the most likely to metastasize. And so these two, radiation and surgical removal, will cure it. Then melanoma is the rarest, but it's the deadliest. Okay. Appear flat, spreading, uneven borders, sometimes bleeding, itching. It's the most it's commonly is fatal. Okay. So here are some signs. Okay, asymmetrical border, irregular, color varies, diameter is greater than 6 millimeter. Evolve in shape, it grows, gets bigger. Okay, sometimes elevated. Okay, firm and growing. Now, skin disorder. We have eczema, acne, seborrheic dermatitis, psoriasis, cold sore, impetigo, scabies, hives, and wart. Here are some general ones. Eczema and dermatitis. It's a general inflammatory response due to allergies, infection, poor circulation, exposure to chemical, heat and sunlight. Dermatitis just means inflammation of the skin. You've had some, like that, dry, itchy patches. Can lead to bleeding. Okay, usually treat with cortisol cream, immunosuppressant cream. Bacterial infection, acne. Okay. Caused by hormone, as testosterone when you're becoming a teenager. Hormones are surging, and then your body will produces excessive sebum. Again, sebum comes from the sebaceous gland. Then it blocks the hair follicle, and then infections start happening, and then you get an acne. Okay, impetigo. Okay, it's a Staph aureus. It's highly contagious. Okay, transfer via contact. Decubitus ulcer, death of the hypodermis. Remember where the hypodermis is? Usually, call it bad sores. That's why someone who's in a coma or something, you need to move them around. Otherwise, the pressure from the body of the weight, it causes bed sores. And then the hypodermis dies, and then bacterial infection comes in, and not good. Okay, not good. Scarlet fever, bacteria infection in the throat due to toxin in the blood released by microbes. Viral infection, rubella and measles, can lead to pneumonia and brain damage. Chicken pox, you heard of chicken pox. Okay. If you didn't get it, as an adult, you might get the same chicken pox, but it's called shingle. Okay. The virus is the herpes zoster, and it's the same virus. Okay, but it's much better to get it as a kid. You get the Varicella zoster. That's the name of the virus. Okay. cold sores called herpes simplex. Okay, it's related to the chickenpox virus. Is dormant in your nervous system, and once you are stressed, you'll come out. You'll have herpes simplex forever if you ever had a cold sore. It's in your body forever, and when your immune system is compromised, it is then active, and then you have cold sores. Discoloration of the skin. So just some terms. Cyanosis. Cyanosis is blue. You see this in blue color. Okay. Impaired circulation or respiratory function. You see some people with bluish lips, and someone who died from drowning or whatever. Their lips will be blue because there's no circulation of blood. Or jaundice. Liver damage, hepatitis. You see a lot of them, their skin is unnaturally yellow. Okay, is the result of biopigmentation, decreased breakdown of the blood. So just like a baby, when they're born, sometimes they're afraid that because there's a lot of breakdown of the blood cells, so they will look more jaundiced. Okay, so one of the things when you have a newborn, be aware of it, and then sometime put them under UV light will help. Fungus, ringworm is also highly contagious. I don't know if you guys have ever had it. It could come from animals. Scaly inflammatory response seen in common with scalp, genitals sometimes. In the bare open skin. Here, sometimes you see it behind the ear or something. Okay, and the genital is called jock itch, and in the feet is called athlete foot. Genetic problem. There's of the skin. Well, you see it in the skin, but it's called psoriasis. Increased cell division in the stratum basalis, abnormal keratin and production. So you'll see they have a lot of, especially in the elbow here, in the elbow, they'll have a lot of, when they scratch, it's a lot of skin flaking off. Call it like silvery scale. Okay, but it's very noticeable. It is once you have psoriasis, once it's like really bad, and you'll be able to see it. Bleeding is due to dermal invasion, and of course it's itchy as well. So injury, I think we've seen this before. Okay, first you have the wound. Okay, then the macrophage, everything. So again, 4 cardinal signs. Okay, there is swelling, bleeding, sweating, hotness. Okay, well, in this case, there's bleeding as well. Swelling, hotness, redness, and then inflammation. Okay, so the reason for the inflammation, because everything swells up, so that the macrophage could come in and clean up the site. Once they clean up the site, start producing, the thrombocyte will start producing blood clots, stops it, and then the fibroblast will come in and start repairing things. Okay. Burns, intense heat, radiation, chemical burn. Okay. Widespread damage. Because the skin is damaged, you could dehydrate, loss of water. Remember, the skin helps with keeping you from dehydration. And then, of course, it's the first line of defense. You have infection coming in. It's classified by the depth of the tissue damage. Okay? And there's something called the rule of 9. Okay, now look here. Use rule of 9 to replace body fluid and electrolyte. You can look at this chart for reference. And depth and classification, we've all heard of first degree, second degree, and third degree burn. Okay, first degree burn, superficial. Okay, only the epidermal area. Okay, red and painful with slight edema. Edema again is swelling. It heals in several days. Second degree damage, damage also to the dermis, so deeper. More pain, red, edema, blistering. Okay, it takes about 2 weeks to heal. Full thickness, which is called third degree burn, the epidermis and dermis will also affect sensory and nerve endings. Okay, fourth degree affects the underlying muscles and bones. Full thickness cannot be repaired by the body. Okay, again, full thickness is a third degree burn where it affects the nerves. Okay, you have to do skin grafting. Skin grafting speeds healing and prevent wound contracture. Well, that's all you need to know for this chapter.